Good evening, everyone. Thank you for joining us. That was quite the intro music. I feel like I might be at the Grammys or maybe the Super Bowl. I'm not sure, but nonetheless, appreciate everyone joining us tonight for this info session. My name is Ryan Moriarty, Vice President of Development and Enrollment Management at Western Atlantic University School of Medicine. And we're here tonight to talk about the accelerated pathway to MD, which is an exciting partnership between Albany College of Pharmacy and Health Sciences and Western Atlantic University School of Medicine. So you have to forgive me because we're going to consolidate those two school names a little bit throughout the call. If you hear me talk about Albany, it's for Albany College of Pharmacy and Health Sciences, and WAUSM is the acronym for Western Atlantic University School of Medicine. So Albany and WAUSM is what we'll say for the time being, just to save ourselves some words. I'm excited to be joined tonight by Dr. Laura Welke, who is our campus dean in Freeport at Western Atlantic University School of Medicine, and by Dr. Betsy Brookins as well from Albany, who is a professor of physiology, anatomy, and director of pre-health pathways at Albany as well. Leslie Anderson, my colleague, will speak a little bit about our admissions process. And I think we've seen some guests here who have already applied to the program or even been admitted. So we're excited to see some familiar faces in the waiting room. So we'll hear from everyone tonight. And in the chat on Zoom, my colleague Chris Fonte is in the chat. If we have any questions that need to be asked or answered, feel free to use that space throughout the call. But again, like I said, we're excited to talk about this partnership between Albany and WAUSM. A little bit about WAUSM to start. We're a new medical school. We were founded in 2018, and our charter class sat in January of 2022. So what's really exciting about that is that this spring, our charter class will match into residency in the United States and graduate. So some really exciting outcomes that really complete the story for those students who've entered the charter class with us that we're excited to share with you here in the next within 2 months. Students who complete their degree at WAUSM get an MD degree. All right, so it's a Doctor of Medicine, and we are located. Our preclerkship campus is located in Freeport, Grand Bahama. So that's the northernmost Bahamian island, and it's due east of Fort Lauderdale, Florida. So about a 25-minute flight from the east coast of Florida. So we'll speak a little bit about what life is like in Freeport and as a WAUSM student, and we'll also dive into some details about what life is like in Albany, New York as an Albany student throughout this presentation. Before we dive into the particulars there, I'd love to just take a step back and let's look at what the accelerated pathway to MD is, because it's a 6-year timeline where a student is going to be eligible to receive a bachelor's degree and an MD degree. So Teddy, I know you're there in the background. Do you mind sharing the graphic that shows what this timeline looks like, just so it might help give some context to the group? So again, this is a look at what a 6-year timeline of the accelerated pathway to MD is. So to give you some context, each one of these dots is a term. So on the far left in yellow would be a fall term, September of 2026, that first dot. Then a spring term starts in January, and a summer term, right? So each year has 3 terms. The colors delineate where those classes are being taken. So the yellow in this instance is at Albany College of Pharmacy and Health Sciences in Albany, New York. Green is the courses taken at our preclerkship campus, WAUSM's preclerkship campus in Freeport, Grand Bahama. And the blue are the clinical rotations that a student is going to complete at a clinical hospital in the United States. So we'll speak about each of these in particular throughout tonight's call, but just gives an overview of what the 6-year pathway looks like. And again, what's also very innovative about this pathway is those first 2 terms that we can see in Freeport, which have asterisks or stars on them. Those delineate dual credit terms. So not only are we able to take courses year round, which help us, take advantage of kind of fallow time in the summer that not necessarily is taught at a typical university setting. But we're also able to offer dual credits to students. So as students are taking courses at WAUSM, those first 2 terms, they're also gaining credit towards their undergraduate degree. So we're able to really overlap a senior year of undergraduate studies with a first year of graduate education. So what could have been an 8 or 9 year path from a traditional setting to graduate lower school and then become a resident physician, we're able to achieve here in about 6 years. So really exciting, really innovative, and ultimately ends with the opportunity to practice medicine in the United States. So with that being said, I would like to talk a little bit about, I guess, if we could zoom in on that yellow setting, and I want to bring into the conversation Dr. Betsy Brookins. So, because that yellow setting is takes place in Albany, New York, at ACPHS. But before we even dive into any academics or what have you, I'd love to just hear about what's life like in Albany, especially for a student who might be coming from another part of the world who aren't familiar with it. We know it's cold, but what else is in store in Albany, New York?
Yes, thank you. So, so I was just going to say thank you for joining. I'm Dr. Brookins. I'm going to give you another acronym. We call it ACPHS. So you might hear Albany, you might hear ACPHS rather than saying Albany College of Pharmacy and Health Sciences. So, as Ryan said, let's start here on the positive note. We have 4 seasons. We truly have 4 seasons where we will have 90-degree days. Right now, we are in a little bit of a cold stretch. It's a heat wave of a day. We hit mid-20s, but we're going to be back into the low single digits over the weekend. But we are in the state capitol. So if you can see on the screen, we have some video showing campus. So ACPHS is located in the state capital of New York, about 2.5 hours north of New York City, right on the Hudson River. So directly north from New York City. We are in the healthcare kind of hub of the city. So if you looked at Albany, directly across the street from us are 2 hospitals. And there's the Department of Health has some research next to us. There's some additional, healthcare clinics and offices all around our institution. Also, at the same time, we're located right between another undergraduate institution and some graduate institutions. So directly across the street from Albany Medical College, directly next door to Albany Law School. So coming to our campus, you are going to be surrounded by other students. There's going to be neighboring students. There's going to be healthcare professionals in the area for you. It is a safe area. It's a small institution, so you're going to not, beyond the first year classes, your classes are mostly going to be about 15 to 30. And as you can see on the screen, we have athletic teams. We have numerous clubs and professional organizations for students to join. Some of them are medically related, like HOSA, which is Future Healthcare Workers. We have AMCA. We have Doctors Without Borders. But then we also have for students intramural club. We have, different clubs for raising money for cancer. We have clubs that do arts and crafts. We have music related clubs and organizations. So it's really an opportunity, even though we're a small school, you can still continue to enjoy and get involved in all of those things that you probably have done in high school or maybe, younger while you were growing up. And unlike WAUSM, we are over 140 years old. So we started as a college of pharmacy. And thank you, Sarah, for putting a link in the chat. We started as a college of pharmacy, and then about 20 years ago or so, we expanded into many other health sciences, bachelor's degrees and master's degrees.
And it's very helpful background. And I'm curious too. If a student wanted to get to New York, there's Amtrak,
Yes.
right? There's a train station.
Yes.
There's an
Yep.
international airport nearby. Just do you mind giving a little context on you're an urban setting, right? But there's also outdoors,
Oh, yes. Yeah.
items to kind of take advantage of over the weekend. So I think that's helpful context too, maybe.
Yes. Yep. So again, we're just a relatively quick train ride. So right across the Hudson River from Albany is a train station that leads right down to the city. Very easy to get right into the heart of the city if you want to do that. If you looked at a map, and we're like 2.5 hours from New York City. If you look east, we're about 2.5 hours from Boston. If you look west, we're about 2 hours from Syracuse. So we really are centrally located. The other thing is that even though we're in an urban area, and I will say a smaller urban area, we are not, Albany is not a Chicago or a New York City or a Boston. It's a smaller city. But we're 20 minutes from Albany International Airport, very easy to get to. We have a public transportation and bus system that is around the city and can take students to various places. We also are about, I'd say 45 minutes to an hour from the Adirondack Mountains. So, we have students that go hiking, go up to Lake George, spend time at the lake, different things. So, lots of different opportunities. So even though we're in the city, it's very easy to get to the suburbs, very easy to get to numerous things. And if you're a skier, which is great time of year right now, there's tons of cross-country skiing, downhill skiing, all within a couple hours of the campus.
Awesome. Well, no, it's certainly a good place to study and then also be able to let loose, so to speak, on the weekends when you need to have some recreation. So, thank you for that context.
Yeah.
Let's talk a little bit about the curricular structure, right? We've worked very closely over the past year now on aligning the biomedical sciences program at ACPHS to then set students up for success at medical school. Do you mind speaking a bit about that program and what students would be studying at Albany before entering medical school?
Yes. So as Ryan said, in this 6-year program, you are first a student at ACPHS, and you're a student at our institution for about 2.5 years before you transition and go over to WAUSM. So at our institution, you would be completing your coursework in biomedical sciences. Essentially think of biomedical sciences as the biology degree, but really health science and human focused. Our institution is a health science focused institution. We are focused on the human in our classes and in our programs. So what we have done is we've worked with a program director for biomedical sciences and taken that 4-year curriculum and essentially broken it down into 3 years, but you'd only be at ACPHS for 2.5. As Ryan said, there was a little bit, I think they were the green dots with X's in them that were the dual credit. So those are the ones that you take at WASM to count for your curriculum. But yes, we have consolidated and made a curriculum grid for 2.5 years that will allow the students to prepare for medical school, prepare for the MCAT, and complete the majority of their degree requirements at our institution. And one of the requirements that we will talk about is you do have to take the MCAT before you transition from ACPHS to WASM. So our classes are aligned with the material on the MCAT. I've worked with our faculty, shared outlines of the material that's on the MCAT, and how does that fit in with their course objectives, their course content. And I like to tell students that as they are taking their pre-med courses and they are completing their biomedical sciences degree, they are also going to be inherently studying for the MCAT. We also have students that do third-party discount or prep courses. We do have an agreement with one of them for a significant discount for our students. So if students want to do that to help increase their chance of success on the MCAT, we can do that. But they're going to learn all of the material, whether it's the biological sciences section, whether it is the physics section, the biochemistry, the psychology, sociology. Taking our curriculum that we have designed for students in this program will allow students to learn all of that material in their courses.
And Dr. Brookins, I think what's
Yeah.
one of the beauties of this pathway, and I think we've seen this with students who are preparing to go to medical school, and they might find out their senior year that they hadn't taken certain courses that they needed to really qualify to even apply to medical school, because there are prerequisites, right, that every medical school requires. Where I think by aligning this curriculum, that's already spelled out for the student, right?
Yes. Yep. Yes. So within this curriculum, we have all of those pre-med courses built into the curriculum. So students don't have to think about, okay, what am I getting for my bachelor's degree? Plus add on all of the pre-med courses and make sure they're staying on top of it and make sure that they have taken this series before that series. It's all built into the curriculum. So from day one, students are already on that pre-med path and taking those pre-med requirements to be successful in medical school. The other thing is our curriculum is not only science. There are electives, there are non-science courses built into that. And I like to tell students we help to prepare them for the MCAT and for being a pre-med student. We also prepare them to be successful in medical school and to be a great healthcare provider. So, how do we do that? We have classes like bioethics, we have intercultural communication, we have patient provider communication, a lot of things that the medical school will talk about, but start getting exposed to that material and start thinking that way in undergrad so that we're not just focused on, preparing you to be a good student, but long run preparing you to be a great healthcare provider as you do that. The other thing I want to mention, going back to that diagram that Ryan showed with the yellow and the green, after that third year, so after that first year at WAUSM, students will actually earn their bachelor's degree from ACPHS. So students would get that about halfway through this 6-year program as soon as those dual credits come back.
Perfect. Yeah, no, thank you. And Teddy, I know I think we have an exhibit we can share that shows some context around the curriculum at Albany that I don't want to spend too much time on, but this would at least give students an idea of really the rigors of what a term looks like at Albany, where each one of those, again, those 7 yellow dots that we saw in that first timeline slide, each one of those dots is kind of represented by one of these boxes or grids. So that first term at Albany, students would be taking these 5 courses outlined here. So, Dr. Brokers, do you mind speaking a little bit about this and perhaps how the summer courses kind of fold in this pathway as an opportunity for students to matriculate to WASM in an accelerated fashion?
Yes. So this is an accelerated program. So you should anticipate taking a slightly heavier course load than a student that is planning to go 4 years and then 4 years into medical school, and also the summers. So that first year, that fall and spring semester, are a traditional pre-med that is a biomedical sciences student. That's their traditional 5-class sequence. So we're not throwing students into an extra class that very first semester. They're starting to pick up and get some of those additional credits, starting to prepare for the MCAT and prepare for medical school earlier, starting in the summer. So we put the summer classes, 2 of the science sequences are in the summer. So the first summer, students would take organic chemistry, and then the second summer, students would take college physics. The reason why we put the organic chemistry in that first summer is so that students can get biochemistry done before the MCAT. It's a section on the MCAT. It is a challenging science. It's not something students want to have to teach themselves. So we want to set them up for success. So that first fall and spring, typical pre-med curriculum, and then that summer is where you start to add things in. You're not taking these classes at the same time. You take organic chemistry 1 for the first summer session, and then organic chemistry 2 for the second summer session. So you take them back to back. It is shorter semesters than a typical semester, but it's fresh in your mind when you end the one summer session to go right into it. And then, your fall and spring semesters are pretty typical, those 4 or 5 classes. And then, because you are completing the degree early, we get some of those credits from the summer. And then the rest of the credits to reach our degree requirement come from those classes from WASM that students would take in that spring, summer, and fall of their 3rd year.
Yeah, awesome. Yeah, this is super helpful. I think just mapping out the courses they're taking and when they're taken. And what I'll also highlight is this last red bucket here on the bottom left-hand corner of the slide. That's that final fall. Students are
Mhm.
taking courses in Albany, and this is where we really begin to align and prepare students to matriculate to WAUSM and to move to Freeport to begin their medical school studies. So there will be benchmarks throughout a student's studies at Albany, where a minimum GPA would need to be maintained and other items that we'll share as well with the group. But those benchmarks, as long as those are met, students really have a seamless transition to WASM. So that's one of the great components of this pathway is that you're really applying once to two
Mhm.
different schools, and there's not that anxiety necessarily of do I need to apply again or do I need to enter a new admission cycle? So this really allows for a student to really kind of seamlessly transition to medical school. So Dr. Brookins, super helpful. You're off the hot seat for the time being. We're gonna transition to talk a little bit
Yeah.
it's about WASM, and I think this is a great time to one introduce my colleague Dr. Laura Welke, and if you don't mind, Laura, could you give a little background and kind of what brought you to WASM? Because this is you've been here from the get, right? So if you don't mind.
Yeah, and good evening, everyone. It's a pleasure to be here, and it's so great that everyone's joined us tonight. We're so excited about this partnership. So I'm Dr. Laura Welke, and my background, I have a PhD in anatomy and neurobiology. I went to Boston University School of Medicine and worked at SUNY Downstate in New York, in Brooklyn for a few years, and then I really got into international medical education. So I've really done my almost my entire career, 20 years, and in this space, and I just love it. I love providing students with the opportunity to pursue their dreams of becoming a physician. So I was just overjoyed when I got the opportunity to start a new medical school here at WASM, and I'm sitting here in Freeport, Grand Bahama, and like Ryan said, we're going to have some really exciting outcomes with graduating and matching our first students. So I'm just thrilled to be here. I think it's a wonderful place, and happy to talk more, but I'll keep it brief. So.
No, thank you, Dr. Bucky. No, so I think at a high level, you've seen students from the United States, you've seen students from other parts of the world kind of come through your classes. You've worked alongside colleagues who have taught at U.S. medical schools and at international medical schools. So there's really at WASM a wealth of experience, and that helped kind of flip the script a little bit on what teaching medical education is like. Do you mind speaking about like how we develop the curriculum and what's unique about it, and maybe that segues into what classes like on campus. We could talk a little bit, but that I always love hearing about that.
Yeah, of course. And I think what I'm really excited about hearing Dr. Brookins talk too is like this is a foolproof program. Like you don't have to worry about they're looking at that coursework that you're going to be taking at Albany is tremendous. The biochemistry, the molecular biology, the communication courses is it's just setting students up to succeed here at WASM. And I love seeing that. I mean, I hear from faculty all the time, oh my gosh, we wish students were taking biochemistry, and I'm seeing that here. So this is just fantastic. So what we do different here in at WASM is you're coming here to become a physician. And so what we have done as faculty is really focused on what do they really need to know to become competent physicians, because there's so much medical information out there and so much medical knowledge, and it can become, they say, drinking from the fire hose. So there's a lot of cognitive overload. And so what we've done is we've been using the National Board of Medical Examiners and the United States Medical License Exam. I know those are big words, but we've been using their content outlines and really honing in on what do students really need to know. And we've also integrated our curriculum so you won't be taking an anatomy course and a biochemistry course and a physiology course. What we're doing is teaching it by disease. So you will have sessions on hypertension or leukemia and lymphoma or how to interpret an EKG. And so that gives you the relevance. And then we tell you what of the basic science do you need to know for hypertension or for leukemia and lymphoma and that kind of thing. So in the classroom, there might be multiple faculty in there. So there might be a physician, a pharmacologist, a biochemist, and they're all pinging off each other. And this is an active learning environment. So we're doing questions, we're doing problem solving, we're doing cases, and we're constantly challenging students to ask us, why should I care about this? Why do I have to learn this complex pathways on metabolism? And we'll say, yeah, it's hard, but you need to know that for diabetes. You need to know that for metabolic syndrome and that kind of thing. So we're always tying it to the patient and the disease state and the why. And so I really think it's a really fresh and modern medical education program. There's still a lot of schools out there that are really discipline based and siloed. And here we are collaborative, um, and we're active and integrative. And you'll see our classrooms are even different. You know, we have very modular stations and students work together, and it's case-based and problem solving and all that. So similar to Dr. Brookins, I can talk all night about our curriculum and things, but Ryan, ping me with more.
No,
What else do we want to
it's
know?
it's all good. I like what you touched on there because and Teddy, when you have a moment, if you could share a little bit of the timeline slide with what curriculum looks like in Freeport. But what's interesting is that the curriculum in WASM in Freeport, it really juxtaposed against what we showed at Albany is that there is a super strong foundation built at Albany, right?
Amazing.
With very specific courses. But like you said, at WASM, it's systems based and it forces students to really learn how to apply all of those disciplines into one so that we can see a singular patient and understand how to serve them. So if you could speak a little bit about that too, maybe even use one of the Foundations of Medicine courses as an example, because as you'll see, folks, there's only two courses taught a term, not four or five like we saw at Albany. So it's an interesting complementary program throughout, right?
Yeah, absolutely. So what you see here is in green, this is Freeport. And so you do, as Ryan said, each one of those dots is a term. So we have year one and two, so there's 5 terms and it's 20 months here in Freeport. So this dot here, let's say this is spring. Um, the first dot is spring, and we have 2 courses. We have something called a Foundations of Medicine course, and then a Patient-Centered Care course. And the Foundations of Medicine course is what you'd think about in learning the physiology, learning the biochemistry, all of this. But what we do is we do it in units. So in our, let's say in our Foundations of Medicine 1 course, we have a molecules to medicine unit followed by a musculoskeletal unit. And so we teach things in organ system based units, as Ryan mentioned. In semester 2, then you move into cardiovascular, respiratory, and renal. So everything is based on the organ
Mm.
systems. And then we teach the classes, like I mentioned, like cardiovascular, you're going to have congenital disorders of the heart, or pediatric workshop, or hypertension, or arrhythmias, or interpretation of EKG. So it's all clinically based. What's awesome about this? Ooh, here's a cool thing. So I was just talking about Foundations of Medicine 2, cardiovascular. What's awesome about this is you're in the classroom in the morning in the cardiovascular unit talking about interpretation of EKGs or arrhythmias, like abnormal heart sounds. So that afternoon, you may go to the other course, which is patient-centered care. And all this entire course occurs in our clinical environment, in our clinical building called our simulation building. And so you might have physical exam skills or a simulated learning environment with our high fidelity mannequins. And so, as I mentioned, if you're learning in the morning in Foundations of Medicine about arrhythmias or EKGs, that afternoon you're going to go into our clinical environment and you're going to actually use our task trainers and our heart sounds trainers so you can actually listen to the abnormal heart sounds and work through that or work through interpretations of EKGs in different scenarios. So we have intentionally built our curriculum to be very logical flow. You're not having something in the morning on some metabolic biochemistry thing and then going to a respiratory session, unless they're related in some sense. So we're very intentional about making it logical. We make it flow very nicely. Um, and it's just, I think the students really, they're just really enjoying it. So I'll stop there.
Yeah,
What
no,
else?
I think they are because like the outcome that we see at the end of this session is students do sit for the USMLE Step 1 exam, right? So
Correct.
we're really happy to share that we do have a 100% Step 1 pass rate from our students, and that's a credence to the excellent work of the faculty and the support that's given to those students, as well as the hard work and dedication that they've put forth. But once that coursework is completed, students do return to the United States for their clinical rotations. And Teddy, I'll ask you, sorry, I'm putting you to work. If you could put back that slide, but show the green dot, excuse me, the blue dots, that will show us some detail on the coursework that students pursue in the clinical setting for the last 2 years of the 6-year pathway. So again, these blue dots are the final years of the pathway, and that's in the US. So do you mind advancing a couple slides here, Teddy, to that detail? And Dr. Wilkie, do you mind speaking just a bit about what's required here as a student really becomes a doctor even further?
Absolutely. So you'll do your 20 months here at WASM in Freeport, Grand Bahama, and then you're going to transition to the United States, to one of our partner hospitals. And what we call this clerkship. But this is going into the hospital and rotating through all the specialties, which is super fun. So you see that there's six what we call core clerkships that students need to participate in. So that's surgery, internal medicine, pediatrics, family medicine, psychiatry, and OB-GYN. They may not take them in that order, but you see surgery and internal medicine are 12 weeks and the other are 6. So these will make up your entire third year. And you'll rotate through those clinical rotations, get the experience, see the patients in all of those, and really decide sort of what you'd like to do. I mean, we started career advising in semester 1 right away, but we see so many students who say right away in semester 1, I want to be a surgeon, I want to be a surgeon, and by the time they finish their third year, they're like, oh no, I'm going to do pathology or something. So these are really great. Of course, working with patients, getting into the hospital system, networking, making relationships, and just furthering your physical exam skills and patient care. Um, and then what's really neat is after your third year, you're going to take another licensing exam and then you enter year 4. And year 4 is all about electives. So electives are like if you really want to do surgery, you could do a surgery sub-internship or neurology or geriatrics or some other electives that aren't, that are sort of more specialized, um, away from the core clerkships. But the other thing that's really important about year 4 is you're really working towards match and matching into the residency of your choice. So, and I can't emphasize enough that you're going to have support the entire way, really, really shaping and helping you with your interviews and your personal statements and the career advisement, and all of that is built in while you're getting this training and the experience here.
Thank you, Dr. Welke, and thank you, Teddy. This is obviously an amazing overview, and it's a lot, right? You think
It's a
about
lot.
who can be geared up to dive into this and really excel on a 6-year path like this, and it's someone who's going to be very driven, determined, strong science, foundation and mathematics foundation, but someone who knows what they want, right? And that's going to be the kind of the candidates that I think we look for. The cohorts themselves and the class sizes will remain small, not to be exclusive, but to make sure that we can give students the attention that really is required and the support that's required to really create an environment that is the best for you as an individual student, but also for your classmates as well. So again, if this is something that interests you and that has piqued your interest, we do encourage you to apply. And I would like to invite my colleague Leslie Anderson to the conversation right now, just to just talk about what that's like and what it takes to apply. So, Leslie, if you don't mind speaking a little bit about that process and take it away.
Yeah, thank you, Ryan, and welcome everybody. Thank you so much for being here to learn more about WAUSM and ACPHS. I'm Leslie Anderson. I work very closely with Dr. Welke and Dr. Brookins and Ryan and the Albany admissions staff in really helping to advise students through that process. So, that care, starts from day one when you are inquiring and applying. We will walk through a few different ways. There's actually two specific ways that you can apply to the APMD pathway. For domestic students, you would do that through the Common App and apply directly to Albany. And if you are international, you can apply through our website at wasm.education, and you would select the 6-year pathway, and we will review your application and prepare it for Albany. Perhaps Dr. Brookins can talk to you a little bit on some of the key admissions factors that Albany looks for in an ideal applicant for this type of accelerated pathway. And then I can walk you through the rest of the admissions process.
Yes, thank you, Leslie. So so as you can see here, the ACPHS application review and acceptance happens, within this timeline and this flow chart. And we work very closely with Leslie, our admissions and WASM admissions, so that we can transmit information, share conversations, things like that. So yes, what do we look for? We are looking at the application coming into our institution as an undergrad. So we're looking for 4 years of math, 4 years of science. We are looking for students that are involved in their community, in their school, in their area. We also understand that students applying maybe 16, 17, 18 years old, they're not going to have, a job in a hospital in the healthcare setting, but have they started talking to people? Have they started to explore this career? Whether it is shadowing a physician, whether it is volunteering in a hospital, talking to people, any sort of thing, raising money for, a health cause. So we're looking for not only a good, high achieving student, but we're also looking for someone that has that interest and has started to grow their interest. I was talking to some of my pre-med students the other day, and I put up a figure talking about their interest in medicine. And I put up a little seedling growing. And I'm like, that's what we're looking for. We're looking for that seed. Where did that interest initially come from? And have you started to grow that? We're not expecting a full pine tree. We are expecting just some experience, some involvement. And we do look at your writing skills. You do have to submit a supplemental essay. So we start to look at those things in addition. But, the math, the science is important to us, the interest. And we're not looking for any particular interest or where that, interest in medicine came from. People have many different stories, and we love reading all of those stories. But really, that's what we're looking for in applicants, at least initially. And then we are sharing them with WASM, and then they're looking at them more from their lens from the medical school. So we're looking at it from the undergraduate side and also the pre-med side. And then we hand it over to Leslie and her team to kind of look at it further.
Yeah. Thank you so much, Dr. Brookins. Yeah, as you can see from this timeline, there's a lot of conversations that take place before and after the application process. Once that application has been approved and you have all of the documentation and Albany has reviewed it and given you that acceptance, then that is when, as Dr. Brookins was speaking about, you will come over to our hands again. We do one-on-one virtual interviews, and that is where we do go into more depth about your passion for medicine and your knowledge of the field and what you're about to dedicate your life to. So these are all sort of things that we talk about, as well as the quantitative measures and the classes you've taken thus far. And then once that interview is complete, then you are presented to our admissions committee. Well, they will review everything and render a decision. Once that decision comes through, then we will contact you directly, and we liaison with Albany too as well and let them know. And we will move forward in the next steps of the process. So all in all, it takes about 3 to 4 weeks if everything's moving efficiently and we have the documentation that we need in advance. But yes, and you have me as a point of contact, as well as Dr. Brookins and the Albany admissions staff too as well. So that's just a really quick, brief overview. I know there are individuals on here that I've already started advising, maybe have even interviewed already and are being accepted and going through that process. So we're really excited for you guys to be here, learn more about Albany, learn more about WAUSM, and certainly look forward to anyone who's interested can reach out and contact me directly, and I'm happy to answer any questions that you may have.
Thank you, Leslie. Yeah, like as Leslie had said, if you're interested, we're here to help. So please take that leap of faith and apply, because we're confident that we can help you get to where you want to be. Just simply put, high school transcript, personal statement, letters of recommendation or one letter of recommendation, and a resume or listed activities is really what's needed initially to get this application process started. So we will share some information after this presentation, not only with a recording, but also with the list of some of those items, as well as contact information for folks who you can reach out to, including myself or Leslie and Dr. Welke and Dr. Brookins to answer any questions you have. But with that, that is the information we had to share tonight. We appreciate everyone joining. I want to thank Dr. Brookins, Dr. Welke, Leslie for all your help, as well as Teddy in the background and Chris Fonte in the chat. Thank you guys so much. Have a great rest of your evening, and we look forward to hearing from you soon.